Tom, without further ado, I appreciate you hopping on. Why don't you give us a quick rundown on who you are and who you serve?
Yeah, so my name's Tom Ingegno. I have my doctorate in acupuncture and Chinese medicine. I've been practicing, I think it's the end of May will be 24 years officially completed. With that, I've had the opportunity to have about six different locations, three of them in New York, where I was practicing for the first 5 years, where I was born and raised, and then moved down to Maryland almost 20 years ago and opened up shop in Baltimore. And four of those clinics have expanded, and now I own an integrative health center called Charm City Integrative Health. Everything's based off of classical Chinese medicine principles, but we do things like cryotherapy, cold plunges, red light therapy, sauna, exercise with oxygen therapy, salt therapy. I think I got most of them, but how they all affect the body is in my head very similar to some of the ways that acupuncture works, which is reducing inflammation and increasing circulation and stimulating the body to kind of repair itself.
Yeah, no, it sounds like you have quite the diverse background, and I love hearing about that. But what was the catalyst that kind of got you into that, got you started?
Yeah, it was weird. I wasn't railing against, modern medicine or Western medicine at a young age or anything, but I was pre-med in my undergrad, and I just had some experiences where I wasn't really thrilled with the way Western medicine kind of treated people, right?
Mhm.
It always seemed weird to me that you go twice a year and they just tell you you're healthy, right? Okay, I'm going to give you my blood, and as long as I'm not too heavy or the blood work comes back normal or I don't have something that hurts, you're going to say, okay, see you later. There was no discussion about how to stay healthy. There was no discussion about how to have a vibrant life. And I remember growing up being part of an HMO, and I had to go to like this one center, and I was getting allergy testing or something there. And I said, look, it was the summer, I had to get to lifeguarding. Let me take your earliest appointment. Booked the earliest appointment. And when I showed up, there was already like 10 people in the waiting room.
Wow.
And, I said, I thought I had the earliest appointment. She said, you do. All these other people do too. And I went, okay, I specifically made this because I got to get to work, not trying to give whoever at the front desk was a hard time. And then about 45 minutes went by and no one had left the front office. They didn't call anybody back. And I went up and I said, look, I really got to leave for work. Where's the doctor? Why hasn't she taken anyone? And they said, oh, she gets here around 11. She's in surgery now. And like, it broke me a little bit. I'm like, how dare you guys book appointments at a time when the doctor's not here? More
Yeah.
people had shown up. The waiting room was full,
Mhm.
and, not saying that seniors don't have anything better to do, but like the room was full of senior citizens that were probably sitting there and they were going to wait the whole day. This was not a life or death situation. It wasn't an emergency situation, but it really felt like a big disrespect to everybody in that room's time. It kind of put a bad taste in my mouth. And then I started seeing a lot of people that were just like, well, I just take this pill. Well, what did they tell you? Like when do you get off the pill? Oh, I don't. And certainly if you're type 1 diabetic, I get that, right? Yes, you're going to need
Mhm.
insulin, man. That's going to keep you alive. But in most cases, if it's pain, if it's high blood pressure, if it's cholesterol, if it's these things, there's so many things that we can do to change our lives if we're willing to put in the work to stop that. And I'm not saying don't take the high blood pressure medication. I'm like saying take that, but look for alternative routes while you're making sure you're safe. What else can you do? Is it diet? Is it exercise? Is these things? The six pack abs and that's not the picture perfect of health, and certainly that shouldn't be something everybody strives for. But not falling over of something that you could have easily prevented, I think is like that seems more right to me. Like how can
Yeah.
we do that? In East Asian medicine as a whole, I mean, when we talk about it in the States, we talk about acupuncture mainly because that's what's regulated. That's what my license is in. But East Asian medicine is this giant animal, right? So we see Chinese herbs, acupuncture, we see cupping, we see moxibustion, which is the herb that we burn on the head of the needles or on the surface of the body or in a
Hmm.
device over the body. But we often don't talk about the other elements because they were done at home, right? So qigong, breathing exercises with mild movements, stretching, body alignment stuff. There's a lot of folk massage. Tui Na Ama are two popular ones that this is a physical modality for healing. Even the foods that you eat, they should match your constitution type is the theory, right? No one gets
Mhm.
that 100% right, but look, here's some foods that are in season. They're going to help you lead to better health, and this is what's better for you as who you are as a person. Meditation is another big cornerstone of that. And they don't tease out the psychology from the emotional intelligence from the physical health, right? It's all one thing. And this tends to happen still today with a lot of the female patients, right? They'll go to the gynecologist because something is wrong. The cycle's off, whatever it is.
Mhm.
And the blood work came back normal. The ultrasound was normal. It's got to all be in your head. How about I give you an antidepressant? And it's like you're
Mhm.
not even hearing the patient. And it happens all the time in other disciplines. It just so happens that my practice is like 75% female. So I tend
Yeah.
to run into that more, in general. And I'm not going to make this blanket statement and say it's 100% of the time, but women tend to be more concerned with their day-to-day health, their mental well-being, those kind of things. They're more likely to take action on those things, and they're more
Right.
likely to end up on my table. So within that, I got to acupuncture and Chinese medicine through a postcard in the mail my junior year of college. Like there was an open house for acupuncture, and I'd taken a class the second semester of my sophomore year that kicked my ass. The guy was a surgeon. I believe he was at University of Maryland as a surgeon. He was teaching one elective at Loyola. He told me he spent 8 hours preparing every 45-minute class.
Holy crap.
He was just a brilliant, brilliant man. He was kicking the crap out of me in class. I mean, I was like, you're throwing in a 45-minute class, I can't keep up. And I'm in a room of people that like somebody got a 50 on the test, and that was the A. That was the curve that he graded on. And I'm
Damn.
like,
Okay.
I got a 32 and now I fail. And I'm
Mhm.
like, I'm not that far away from the 50. But within that, he would meet with me on Sundays. He'd sit there and go through the textbook with me. He's like, yeah, I just came from yoga. I mean, 10,000 things. The stereotypical overachieving, super ADHD guy. But we had a talk at the end of the semester, and he goes, look, you did really well on your final. I didn't ace the class, but he sat there and he goes, look, I have no doubt that if this class was a full year, you would have gotten an A, you would have shown. Yeah, it was very, very nice to me. And he said, what are you looking to do? And I said, well, I wanted to be a doctor, like an MD, but I don't really like, it's not really for me. He actually told me a story that when he was doing surgical rounds, they put a heart in his hands and he passed out. And at that
Wow.
point, I was like, shit, that I'm definitely going down if somebody hands me anything. Yeah,
Right.
so it was like maybe this isn't for me, but I had mentioned that I'd taken a Tai Chi elective and that I'd an Eastern philosophy course. And I said, look, this alternative medicine paths, I'm looking at some acupuncture. But in my junior year, I transferred to a school that was with a DO program, doctor of osteopath, because functionally there's no difference if you look at it from the outside. An MD versus a DO, they both work in hospitals. They both do a lot of the similar things. They both
Mhm.
specialize. DOs have a couple of like osteopathic manipulation classes similar to chiropractors, but the bulk majority of them don't even do that. And I was looking at that track, and that's when this postcard showed up during the Christmas break for an acupuncture school that was like 10 minutes away from my parents' house. And I went to the
Nice.
open house, and they're like, oh my God, you have all of these credits. You have all the core biosciences. You have everything you need. Our program gives you a bachelor's in professional health science alongside of a master's in oriental medicine. And let's
Mm.
face it, in today's world, like the bachelor's doesn't really mean anything. That's kind of like,
Yeah.
like a high school diploma was in the 70s and 80s.
Yeah.
So I didn't convince my parents that it was a viable field until after my first semester in the acupuncture program. So I did my second semester of my junior year alongside of my first semester of my graduate program, carrying like 32 classes and bartending, I think 2 or 3 nights a week. And I loved it. I was so engrossed. I swallowed it hook, line, and sinker, and kind of never looked back. It just
Mhm.
seemed so natural. And here we are, 20, well, now over 24 years, but with the schooling, probably closer to 27, 28 of this is kind of what I've done for more than half my life.
Damn. That is quite the journey. And I appreciate you sharing all of that. I definitely understand, by proxy, I understand how, like you said, women tend to be more dismissed or pacified by doctors.
Hmm.
And for some reason, it always tends to be like, and from what I have heard, like the older male doctors are like, oh,
Yeah.
you sure it's not just like, like you said, in your head, it's anxiety. And I've personally worked with a few women who have been to like, I have POTS or PCOS
Hmm.
or both. And the doctors are like, I think it's just all anxiety. It's like I'm having physical, like actual physical manifestations of this. Like there are actual symptoms of this. It's not just me stressing about stuff. And so I actually brought on a female a women's health specialist coach to help serve those clients a little bit better because me very much outside looking in on that. And so
Yeah.
I obviously don't have PCOS, nor will I ever. And so I definitely understand how when you have these symptoms, you know something's wrong. Obviously, you're the master of your own domain. You're going to know your body better than anybody. And then you have the quote unquote professionals saying that's not an actual thing, or it's all in your head, or you're making this up. Not potentially like saying, "Are you making this all up?" I can see how that can be very discouraging. So you being much more open and receptive and accepting these people and having like an alternative form of medicine, I think is very empowering for those individuals and for yourself.
Well, and it's for me too, because when I went back for the doctorate, it didn't exist when I graduated. I had to go back years later. The whole focus of that was let's talk more Western. Let's bridge that gap. Let's look at the research and acupuncture. And this is a funny fact that I say a lot, and some people get pissed off. I'm not attacking other fields here. Acupuncture has more, systematic reviews than physical therapy and chiropractic together, right? So it's considered out there medicine, but the largest amount is done in, well, probably after pain management is women's health. So
Mhm.
it's so funny because taking into account the physical and the mental aspects, putting it all together, it, even if something was in somebody's head, we can help with that as well.
Yeah.
And we don't have to judge. We, in Chinese medicine, we talk about qi, right? And I, unfortunately, as it moved west, and I do believe this was a function of white people, calling it, they're like, oh, this qi, it's this mystical new age energy. And it's like every practitioner I've had as a teacher who is from Asia or trained over there, not this mystical thing, this very real, in a way that we would talk about energy from a physics perspective.
Okay.
Does your body have the potential energy? Can it do the function when it needs to, right? We don't do everything all at once. That would overload our body, right? Not all our
Yeah.
nerves are firing. Not all of our brain is lighting up. You're not pooping at the same time as you're vomiting, unless you're sick, but like we have functions that have a time and a place. And then that kinetic energy is like, is it doing it when it's supposed to? And when
Mhm.
it's not, in this theory before we had MRIs and Dopplers to look at blood flow. Okay, well, this energy is not able to do what it's supposed to do in this area. And sometimes that's drive blood flow. Sometimes that's allow you to digest and that whole system, whether it's the glands or the organs, there's something amiss there, right? So they don't have it dialed down to this, one tiny little atom or this one tiny organelle. But within that, how do we restore that function and get that body to do that? And
Yeah.
and when we look at it like that, it doesn't sound as mystical, it doesn't sound as new aged, but the value in that is so much more. And when
Mhm.
we see like, oh, you have PCOS, well, we wouldn't call it that in Chinese medicine, but this collection of symptoms we can treat. We can give you
Yeah.
herbs, we can do acupuncture, and guess what? Now, not only am I talking from my experience and the experience of the thousands of years that came before me, here's a whole bunch of double blind placebo controlled studies on it. Now, sometimes I believe double blind acupuncture studies are foolish, right? We're trying to convince you that you're not getting acupuncture, or we're putting the points like next to where the actual point is. And it's like you already pierced the body with the skin, with a needle. You've
Mhm.
created a change in the system. So
Yeah.
yeah, that's why the placebo does well too. But
Yeah,
yeah,
absolutely.
why? Because you did a study on knee pain. The point is right at this joint. You moved a half an inch away. You're still near the knee.
Mhm.
It's the goofiest logic. And when I talk about those faults in that, right, you get this pushback sometime, and you're like, well, then you can't study it. And it's like, but that's a limitation of your studying methods. It's not a limitation of the methods that are being used to treat. I also find it funny that, like, when we look at comparative studies, these are the ones where acupuncture really excels. They'll compare to standard of care, right? So, hey, for headaches, well, what do you got? Well, I got Neurontin if it's migraines, but like I got NSAIDs and over the counter stuff. We outperform that all the time. And that's really cool to me, where it's like thousands of years ago, somebody figured out that if I put this needle in, I'm affecting the parasympathetic nervous system. I'm activating
Yeah.
that. I'm increasing circulation. I'm sending the right signals to the brain to stimulate the peripheral nerves to fire the right. And it's one little needle through the skin. Now, why that happens, then I get to be like coy and say, oh, it's the chi. We smooth the flow of chi. Why? Because I have no idea how the hell your body decided that, like, oh, we put the needle here and that happens, right? That's just by design. But it's pretty amazing. Now in Japan, they'll call the needle an artificial splinter, right? I pierce the surface of the skin. Your body's going to send blood there. Why? To make sure it can repair the tissue, fight infection, whatever it needs to do. But when we see changes in the brain during an acupuncture treatment, where we start making brainwave patterns that look like meditation, or like when we see hormone levels regulating, when we see more blood flowing to the gut, when we see neurotransmitters like serotonin, dopamine normalizing, or oxytocin being produced, or endocannabinoids coming out, it's like, how the hell did a needle do that? Right? I didn't go
Right.
anywhere near the damn head. It's a complete system of medicine. And in Asia, going back a long time, your surgeons were also acupuncturists. This was like included in that. They would cut needle, arrows out of you. They would set bones. They would do those things. And here, the scope is more trimmed, and I actually don't mind that so much. Going back to the thought of actually holding someone's organ in my hand, like
Yeah.
I don't want any of that. Like, no.
Yeah, I hear that. You kind of touched on it, but I want to get, can you give me like a layman's definition or explanation on what acupuncture is and how it works,
Yeah,
again, on a layman's level? Because
yeah,
obviously,
yeah,
I'm sure everyone has heard of it, and
yeah.
I'm sure they've seen it in movies where you're getting 1,000 needles on your face and it's supposed to be a comedy and
And
stuff like
that's
that.
and that is so upsetting when you see that.
Yeah,
That is like, Kiss of the Dragon came out years ago, and it was Jet Li and Bridget Fonda, and Jet Li has this little band with needles in it, right? And he sticks needles in somebody's the back of their neck. And if you haven't seen it by now, I'm going to spoil it. But the main bad guy has blood shoot out his ears, and and he falls over dead. And after that movie came out, somebody came in and they're like, "Oh, watch it on the back there," and he was 100% serious. And I'm like, it's a fucking movie, dude. Like if I could do that, the government would not let me pick up an acupuncture needle. Yeah,
right.
like they would definitely regulate that. How it works, right? So classically, I always have to give Eastern Western kind of views of this. Classically, the idea is when you have a collection of symptoms, we're trying to figure out which of those channels, those meridians that run up and down the body, are out of balance. Now, through various theories, we have points that lay along those things that restore that function or help improve that function. We place the needles. Your body responds to that by sending that energy circulating through those channels, and then your body repairs itself, puts it back in homeostasis. From a Western standpoint, we know that there's this overarching effect of and vagal nerve tone, autonomic nervous system dysregulation. All of this is like buzzwords now, right? Like everyone
Yeah.
has multiple devices to stimulate the vagus nerve, or we'll do tapping, or we'll do whatever, breath work, and it all restores that balance. After about 10 or 15 minutes of acupuncture, you get out of that fight or flight mode, that sympathetic, I'm on edge mode, and you go into the parasympathetic mode, which is rest and digest. This is our repair mode. So blood vessels systemically dilate. So we flush out tissue that's not getting fresh blood to it. So we get the metabolic waste, any inflammatory markers like cytokines out of that tissue, and we're nourishing it with fresh blood that has oxygen and nutrients. So one of our classic textbooks, and people in my field get mad at me when I say this is the cop out line in the whole book, right? It says where the chi goes, the blood follows, right? So if I can get blood there, I've got all the building blocks that you need to repair the tissue,
Yeah.
right? That's what's in the blood, right? Nutrients, oxygen, all those things. Even Western drugs work better because I can direct them if they're in your
Mm.
system, which is kind of an interesting thing to think about. But as that happens, we're restoring the function slowly. All of these other effects that happen are basically being caused based on where we place the needles and your body going into that default repair mode, right? So that's when you're going to get more circulation to your gut, so we can help with digestive disorders. We can also help get more nutrients out of the tissue to then help heal other areas. We take
Mhm.
slower and deeper breaths, we're getting better oxygen exchange when we have more blood going to the lungs. Our brain is getting bathed with more oxygen. Our serotonin, dopamine levels are starting to normalize. It's this beautiful cascade effect that, like I said before, we don't know why putting the needle in triggers all that. And that
Sure.
happens regardless of the points that we choose. That's like the added bonus of the whole thing. Now we have
Yeah.
point specificity where we can look at studies and say, hey, when we stimulate this point, we take a blood sample before we do it, a blood sample after we do it, we see an increase in white blood cell count. That's funny. This point is known for strengthening the immune system.
Right.
Hey, we know that like if we do this, we see an increase here, here, and here. And you're like, oh, now you start to cobble together this kind of like pigeon language between Chinese theory and Western medicine. And it's like, this is how we would describe it over here. Here's what we're seeing with the Western data. That kind of lines up. And that is so amazing to me when it's a different language, but they're saying the same thing.
Yeah. Yeah. So if I were to explain it somewhat simpler terminology, it sounds like when you are embedding the needle or the acupuncture needle, like you said, it's a foreign object, it's kind of stimulating some form of autoimmune response that is, again, going to cause some form of inflammation at first, which will get the blood response. And then it sounds like it reduces like the chronic inflammation that might be in that area.
And in fact, Jordan, they use the term micro trauma in some cases, right?
Okay.
I've made a tiny little hole that's so small blood's not even going to come out, but that is enough to start that signaling from the body.
Nice. Are you familiar with who Dr. K is by chance, the healthy gamer?
I am not. No.
He is big in the gaming community, but he sounds very on par with kind of like what you kind of have experienced, where he is a Harvard graduate neuroscientist. I could be no, a psychiatrist, I believe. And he also trained to be a monk for over 7 years. And he went to like India, Japan, somewhere else. He went to like 3 different places and really, really dove into Eastern medicine. And he talks a lot about like the Ayurvedic doshas and stuff like that, and also like Western medicine. And he says a lot of like, the Ayurvedic medicine and like Eastern medicine they're like, 5, 6, 7,000-year-old practices that still kind of hold up. So like clearly some things work. And then he says that there is some translation between doing like you said, doing tests and studies on some of these practices that do hold water on the more Western scientific front. But he was talking about, are you familiar with the Ayurvedic doshas? I'm sure you are.
Yeah. I actually had a guest on my show Thursday, 2 nights ago, or last night. Shit. I don't know what day it is. Who's an Ayurvedic practitioner in Australia. And we kind of found each other because she just graduated from an acupuncture program. She incorporates that as well. So yeah, we've had some big conversations. There's a little bit of overlap between Chinese medicine and Ayurvedic medicine. They don't divide the things the same way, but a lot of these concepts of balance are pretty universal.
Yeah, I really like the doshas, because if you were to kind of like equate it to something more Western, it's like body types, which is largely kind of like debunked old like Jim Bro science. But the way Dr. K explained it, and I really like this, is your cells have the same organelles pretty much across the board, right? Like you're going to have mitochondria throughout your entire body. It's going to be the same mitochondria. And so if you have some form of mitochondrial dysregulation, it's going to show up in your feet the same way, or in a similar way how it's going to show up like in your neck or your brain.
Yeah.
And so people who have the different style dosha, or people who have similar doshas, like somebody who I have been told I'm more of like a kapha, which is like earth and water, which kind of creates mud. And that tends to kind of slow things down. Like you slow digestion, a calmer demeanor, and that could all be related because you have the same type of mitochondria that regulate in a similar way. And so when he has like, the Eastern style Ayurvedic doshas and body types and stuff like that, that seems kind of woo-woo mysticism. But then you compare it to saying, well, we all have, all these people have mitochondria throughout their entire body, and so they could be acting in a similar way that causes you to be a pitta, a kapha, or a vata. And so the way he kind of explains it makes it realize it a lot more, because I came from an academic background. I got my master's in exercise physiology, so very Western style, because where a lot of the people in my grad program, they were going to be doctors and some physical therapists, but mostly they were going to med school. So a lot of the Eastern style practices were seen as, kind of like that taboo voodoo style stuff. And so coming out of that with maybe rose-colored glasses in a sense. But then I worked with a gentleman who was an Ayurvedic practitioner, and he had his own supplement store and everything like that. He was very successful at it. And he comes up to me and he said, we were talking about it, and he says, I can show you over 400 peer-reviewed studies that show that turmeric is a better anti-inflammatory than like ibuprofen and other NSAIDs.
You know what? It's amazing. Turmeric has some of the biggest research as an anti-inflammatory. It's absolutely amazing. And you look at like, God, even like golden milk or whatever they call it. I mean, that's 9,000 years old.
Yeah. And that's pretty much what he was saying. He's like, look, because he was similar too, to where he got a master's in psychology, I think, like that. And then he had a lot. I think he might have been a DO, but he also he gave me like his CV was really long, but he was like the 22nd dragon something. It was like a monk certification or some form of governing body of some sort. And I was like, this guy has the weirdest blend of credentials that I've ever seen. But he was also like, look, if there's something happening, like if you're shaking your leg, that could be slow digestion because the energy keeps kind of like bouncing back and forth and it's not passing all the way through. And like when you kind of break it down like that, where you're saying that these symptoms have these physical manifestations, it kind of like opens the eyes to me to saying, okay, there is actual science behind it, rather than we're praying to Vishnu or whatever like that, that kind of woo-woo type stuff that you might, that an outsider might look at.
Yeah, absolutely. I think, there seems to be this resurgence, and even here I'm in Baltimore. So we have like a ton of big name colleges, a ton of big name hospitals. The younger med students, I've spoken at Hopkins a couple of times, I've University of Maryland, and those, I don't want to call them kids. I mean, they're 20s, but they're kids. Within that, they see the holes in the system, right? Everyone's well aware of the holes, and they're constantly looking for, well, how do I keep them out of my office? How do I give them options? And that's where a lot of these time tested therapies really excel. It's like, no, this is lifestyle medicine, right? There's a doctorate in lifestyle medicine now. You take the damn course, it tells you how to sleep and eat, and you're like, oh God, we're this so removed from being a human that I need somebody with a doctorate to tell me to go to bed. It's not rocket science. It's like, yeah, you should be sleeping enough.
Yeah, that's Peter Attia, I don't know if you know him, Dr. Peter. He talks about how there's 3 versions of medicine. 1.0 was, I just cut my arm off, can we please stop the bleeding and then hopefully delay infection? That was, very early on. Now we're kind of in this 2.0 where we can do a lot of stuff that's very reactive, but you can really prolong stuff like blood pressure medicine, cholesterol, et cetera, et cetera. And then 3.0, which hasn't happened yet, he says it's preventative, right? So a lot of what you were kind of talking about, lifestyle changes, what can we do to prevent people from having he calls them the 4 horsemen of the apocalypse, 4 horsemen of death, which I think are like 8 out of the 10 leading causes of death right now are preventable, like obesity related.
Absolutely.
Or obesity adjacent. So he's like, medicine's kind of trying to shift towards that. But you also, if we're going to put our tinfoil hats on, you also have, big pharma that's saying, we want customers for life. We want you to be on a statin for your entire life. We want you to be on blood pressure medicine, everything like that.
And I don't think that's a conspiracy. I mean, that's a for-profit model. George Carlin railed against it a long time ago. They've been talking about that. I mean, there's folk songs going back to the 40s about this kind of crap, right? If you're going to incentivize a profit, you're putting people, whether they work for you or they're consumers, on the lowest rung of that concern, right? Like, as long as they're paying, like, glorified drug dealing is basically what it is, and I'm not saying that there aren't good drugs out there, and certainly if I get hit by a bus, yes, I want to be in a hospital. I don't like, if you bring patchouli over here, I'm going to get very upset. But on the other hand, for the rest of the time, when I'm being a human, I need to, that's my domain. I need to be able to do things that I can do at home, take care of myself, take the proper supplements, eat the right way, move my body the right way. And I think there's kind of this arch back to that, right? And I think COVID actually shook us up quite a bit. I mean, my clinic,
Yeah, quite a bit.
I gotta say, when I closed, my landlord, speaking of another group of people that don't really put concern of people too high, was like, "Well, what do you mean you're closed? You're a health clinic." And I'm like, "Well, the executive order said urgent care only. Yeah, I might have somebody coming in acute pain, but that doesn't happen that often. And it's not worth it for me to open my office for one person at that point. I'm not trying to make it not about that patient, but like I was checking my phone, nobody was calling. When we reopened though, the first people to come back were those hospital workers, doctors,
Mm.
nurses, even the staff were like, no, you don't understand the stress we're going through.
Oh, yeah,
Uh,
I
but
can imagine.
but the people that came back when it was kind of like, everybody's poking their head out of their front door going, "Can I leave? Can I?" Yeah, uh, we doubled our patient monthly load
Wow.
within like 3 or 4 months after COVID, and
Mm.
it was like, by design we always wanted to get that busy, but
Yeah.
it was really like, no, I think people got the wake up call.
Hmm.
We can't lean on one part of the medical system. We can't wait around for like the miracle drug. We have to do the right things to keep ourselves healthy. And a lot of our services perform best as preventative medicine.
Right. That's what so going back to the guy I worked with, his name's Troy, and I might even have him on my show here soon.
Great.
But he was talking about how, especially in like the Europe areas, like if you go to your doctor and you have high blood pressure, you're gonna sit down with your doctor and they're gonna be like, look, we're gonna put you on this med for the next 6 months. On top of that, you're gonna speak to a nutritionist, you're gonna create start like an exercise routine, and you're gonna change your lifestyle so that way at the end of the 6 months you're off the meds and you don't need the meds.
Yeah.
Rather than America, it's to the defense of the doctors, you have 15 minutes to meet with a patient. You can say, hey, take this pill and really things will be okay. And you should probably maybe exercise, lose a little bit of weight and tune up your diet. That's a lot easier to say in 15 minutes than trying to sit down with them and have an actual consultation on how do you actually lose weight? How do you actually tune up your diet? How do you actually implement a sustainable workout routine? And so I always say, kind of circling it back to my field, I always tell clients, listen to your doctors absolutely 100%. I'm not going to say do something against their advice and never listen to me over them. But what I want to do is I want to help you build that lifestyle, that healthy lifestyle that can potentially
Yeah.
wean you off those meds at obviously your doctor's discretion. And we've had a lot of people just say, hey, look, I'm down like 9 out of my 10 meds, or we're, I've lost 50 pounds and I'm no longer on blood pressure meds, or I'm really like weaning myself off. And
And that's
so,
huge. That's completely, but that is also like a testament to how bodies can repair themselves and reverse
yeah,
damage too. It's so amazing in so many fronts. And on one hand, I'm still trying to figure out the insurance model. Like, why wouldn't you get people moving? Why wouldn't you get people eating healthier food? Why wouldn't you incentivize that? Because down the road, you're not putting, like, the insurance company doesn't have to cover this drug for the rest of their life. Like, I need to explain how like somebody needs to sit down and explain how all that money is moving around between the hospital systems and the drug companies and the insurance company, that everybody's cool with just like, yeah, it'll be cool. We'll just cut his leg off later.
yeah,
Yeah, yeah, like, why is that a cost saving model?
right.
When we can have somebody moving around more, and we can have somebody eating higher quality food, and look, I'm not the anti-vaxxer crazy, like, no, I'm just going to drink apple cider vinegar and I'll be fine kind of person, but like, there's so much that can be done that has real science and real substance to it, that it amazes me that, like, why wouldn't you just pay for that? It's so much
Yeah,
cheaper in the long run.
it
People live
requires more work.
longer, they're yeah, why would that break the system? That would reduce the strain on so much.
Yeah, and it's funny because you can blame it on the academia, you can blame it on big pharma, but you hear a lot, like we were talking about turmeric, and you see, I see turmeric differently now. But if you had talked to me, 5, 6 years ago, people taking turmeric with like black pepper and then CoQ10, it's like, what do you like? You might as well just be taking black pepper. It's completely useless. Let's throw that on your food. Tastes
Yeah.
good. But now it's like, oh, there's actually a lot of
A
studies
lot
that
of
support
science,
that.
yeah.
Yeah, and so it does really kind of open your eyes that they're potentially pushing that under the rug or not glorifying it because they'd rather push something that's, in pill form.
Yeah, I'll tell you this funny story about turmeric. I had the pleasure of working with a functional medicine doctor by the name of Mark Sivieri, and he was number 137 to break the 4 minute mile in college, right? He was training for the
Oh, nice.
Olympics, blew his hip out. I'm probably butchering his story, but has now spent a large part of his life, like fixing himself, and because he's got this like supercomputer like brain, he's gone into functional medicine. And so I'm looking at him one day, he goes, I take 2.5 grams of this turmeric supplement a day. And I'm like, I'm twice that dude's size, I can take that. I took it. Now it's an amazing anti-inflammatory. It also flushes your liver. And I did not, I was like, I'd known that, but I didn't think about that. And I'm like, yeah, let's try 2.5 grams. That is grams, not milligrams, grams. And I proceeded to have a 3-day detox reaction with like sweats that
Jeez.
smelt, massive upset stomach, aches, nausea. And I go, I don't know what happened, man. I don't feel right. And I'm talking to Mark, and he goes, did you take 2.5 milligrams, 2.5 grams of turmeric? Because I told you. And he goes, you just detoxed yourself. You got to work yourself up to that. Like every 2 weeks, add a little more.
Yeah.
Don't just, don't just jump right into that. And I'm like, you left that out of the conversation.
That's funny. Awesome. I do want to segue. I see
Yeah.
you have the book on the cupping book. Can you talk to me a
Yeah.
little bit about like cupping? I heard it, and I think it got pretty popular in like the late 2010s era.
Yeah. So
Talk to me about that.
it's so funny where it's something that's older than acupuncture. We don't know exactly where it came from. Somewhere like Egypt, Greece, Persia, and the oldest text we have is 1515 BC. The Ebers Papyrus writes about it quite extensively. We know Hippocrates used it, but it migrated all around the world. So we're not sure what country of origin, but it's a shared history going back, 4,000 to 5,000 years. It gained a lot of popularity in 2016 when Michael Phelps, was on the pool deck with the marks all over him.
I think that's the first time I saw it because I remember
Yeah.
Googling it. I was like, why does he have all these bruises?
And it's funny because 4 years before that, the acupuncturists and the people that do practice cupping saw all the Asian swimmers with it. And then it just made sense that like 4 years later, they're all hanging out on the pool deck. They're all hanging out in the Olympic Village, talking. And I'm sure at some point, all the athletes that didn't know what cupping was like, what are they doing? You guys figure that out. Where's my athletic trainer? Get him on that. So basically you're creating a vacuum. And you can do that with fire. Today you can do it with suction cups and a whole bunch of other devices. But you create this vacuum with a jar. Grandmas use little wine glasses at home and stuff like that. But so you create this vacuum that pulls the skin up, creates a space between the skin and the fascia and the muscle, right? And because we're relatively a closed system, what that'll do is pull blood to the surface. So once again, increasing blood flow, locally causing some inflammation, right? Because that blood pooling at the surface is older, stagnant blood, for lack of a better term. But the fresh blood that's coming through is now flushed out all that metabolic waste, the inflammatory markers. And what you're left with is a hickey. That pressure has broken the small capillaries on the surface of the skin, and that's why you get the bruise, which is technically an ecchymosis, not a hematoma. It doesn't hurt, but almost instantly, if people have inflammation that's causing pain, they'll see an improvement in that. It's pretty impressive. It's great for post-workout recovery, which is why athletes use it so much. Today's cups, I really wish I had one laying nearby. Normally I have one with a hand's reach, are like silicone cups. They look like a half a tennis ball. You squish it down, it creates the suction, no fire, no breaking of glass like we use in our clinic. And we've reduced 90% of the issues that people would have as a negative effect with it. And why not turn that back over to the households? This was folk medicine before it became anything that somebody was doing in a clinic. Certainly we have some good systematic reviews that have come out late 2010s, early 2020, I believe, that show this is definitely great for back pain, neck and shoulder pain. And then we have some traditional uses like chest congestion and digestive disorders, because we see an increase in circulation up to 6 inches into the body. Of course, like most research studies read, the results are inconclusive. We need more studies on those things. Anecdotally, that's been used since before Hippocrates was born. We do have some good clinical value with it.
Nice. What inspired you to write the book on it?
I think this was the shift in tides where I'm starting to see this resurgence of, I don't want to call it classical medicine, but some traditional practices that really have good modern research. They're meeting all the criteria of evidence-based practice, and they have a historical use of being household treatments, like grandma's medicine. So why not restore that back to people so they can get on that mission of living vibrant, healthy lives, right? There's thousands of people talking about nutrition. There's thousands of people talking about exercise. But what are the modalities that people can do at home that were kind of like not taken away from them, but kind of like just fell to the wayside, that actually have real good clinical value, are safe and effective, and like have some historical connection to humanity itself. And cupping seemed to be the first one, and there's a ton others, and believe me, I'm drafting other books, but this one seemed to be the easiest lift, especially with silicone cups being widely available everywhere for like less than $20. You can buy a pack of silicone cups. They don't have to be anything fancy, and they're going to last longer than you will. And the book was written to be like, it's not War and Peace. It is like a quick user manual. 131 pages cover to cover, and by the end of flipping through that and looking at the pictures, you should be at least competent enough to give it a go.
Okay.
And then you learn by practice, and do it on your friends, do it on your family, do it on your kids, and see how they respond. And have somebody do it to you.
Yeah, absolutely. How can somebody get a hold of that?
So the website for the book is thecuppingbook.com. It is available at any online retailer. So if you're not an Amazon fan, just put in the Cupping Book and it will come up at a website that you feel comfortable purchasing it at. Certainly there's a Kindle version. So yes, it's definitely on Amazon. And then while you're there, take a look at some of the cupping kits, see what you like. We go over every type of cup that's available on the market. We talk about why I think fire cupping is great, but you shouldn't be doing that at home. I just didn't want anybody like suing me for burning their house down. But playing with fire is always fun. And then, the contraindications, which there aren't too many, just so you stay on the safe side of everything.
Sure. Well, awesome, Tom. I know we're at time. I appreciate you hopping on. I had a really good conversation. You made my job very easy, and I learned a lot. And so how can people get a hold of you if they want to get, see more, learn more about you?
Yeah. So my clinic website is kind of the catch-all for everything. It's Charm City Integrative, TIVE.com. Charm City is the nice moniker of Baltimore. And you can, like, if you want to book me for shows, if you want me to come out and consult, lecture, whatever, you can see my CV, all the stuff I've done, and a bunch of boring stuff there too. but yeah, please reach out with any questions.
Absolutely. And I'll put everything in the description of the video too. But again, one last time, I appreciate everything, and we had a good chat. And
so much fun. Yeah, man.
Yeah. Awesome. Yeah. Until next time.